Thanks for joining me at Talk About Pain, and today I've got Mark Callanen. Prior to joining Chattanooga's marketing and clinical education team, Dr. Callanen treated orthopedic patients and managed. I'm going to start over. Welcome to Talk About Pain. Thanks for joining me. Today we're going to be talking about lasers and laser therapy, and I've got an expert with me to ask some questions. So his name is Dr. Mark Callanen. Prior to joining Chattanooga's marketing and clinical education team, Dr. Callanen treated orthopedic patients and managed therapists in an outpatient setting for 18 years. He has been board certified as an orthopedic clinical specialist by the APTA since 2003 and graduated with his transitional doctorate in physical therapy in 2007 from Marymount University in Arlington, Virginia, after earning his Master of Physical Therapy from Shenandoah University in 1999. Dr. Callanen acquired his therapeutic laser acumen after joining Light Force in early 2017 while serving as their Director of Clinical Development. Light Force was acquired by DJO of Chattanooga in December 2020, where he is currently serving as the Director of U.S. Marketing and Clinical Education for the DJO Recovery Sciences Division. He has made formal presentations to mixed professional audiences, both nationally and internationally, on the topic of laser therapy, and has begun lecturing on the topic of shockwave therapies in 2021. Dr. Callanen is also currently serving as an adjunct professor for Belmont University's physical therapy program in Nashville, Tennessee. Mark, thanks so much for being here.
All right, thanks for having me.
Yeah, I have lots of questions for you. And what's kind of fun, so we have a class 4 laser in my clinic, and I've been asking my patients, hey, what kind of laser therapy questions do you have for Mark today?
No better source, right?
So that's where some of the source of my questions are coming from. So let's just start off with the basics. When we're talking about laser therapy, what are we talking about?
Yeah, so, in a very simplistic term, it's talking about light and putting that on tissue and having it have a reaction. So it seems kind of like space age, like, not to age yourself too much, but you think about Star Trek, when they used to, wave wands over people and it magically bones would be like, oh yeah, we're going to fix your arm by waving this thing over you. It seemed like sci-fi back in the 60s, right? But, essentially that's kind of where we're moving. And if you think about, the basics of how light can impact a plant, like if you think about photosynthesis and how we get oxygen produced, it's because light hits chlorophyll and, chromophores that are in the leaf. And then that creates a photochemical reaction, which is what helps us breathe every day. So, when you think about if you dust off the old biology books and think about some of those light reactions that you might have come across that you don't put together, it's a more common thing than you might initially think. But the thing that's happened since they started creating these therapeutic lasers is they figured out, when you sit underneath the sun out at the beach, most of that light gets absorbed by your skin. So it doesn't get into your body really. It's just getting absorbed by the melanin that's on your most superficial layers. But with very specific wavelengths, they can sneak past and get through the skin and then get into the tissues that are below. And that's the magic of these therapeutic lasers, is that we figured out with the right wavelengths, you can get down into muscles and tendons and nerves, and it sparks up healing. It gets the cells working better and sparks up metabolism. And that's kind of the secret sauce on how it works.
Okay, so let me guess, the flashlight that's in my utility drawer won't work for this then?
That is correct. Okay. That flashlight has a broad band of wavelengths, right? And it's at a very low power. So the intensity of that light when you flash it on your arm won't necessarily penetrate anything. But like, to give you a sense, if you happen to have ever come across like a laser pointer and you happen to have a red one and a green one, what I would recommend anybody listening is put it on your fingertip and see which one shines through. And you'll see that the green one, you can't see anything in your fingernail because it's getting absorbed very significantly at the skin level on the other side of your finger. But the red one, you'll see blast all the way through your fingernail. That's just because it gets absorbed at a different different ratio than the green light does. So it'll start to give you a clue on how light reacts with some of our tissue.
Okay. Well, I guess that means that even with 2 flashlights, I couldn't help my shoulder pain then.
Right.
All right. Okay. So let's go into this a little bit deeper. So I know there's been a lot of research about laser over the last many decades. So how does laser help pain?
That's a big question to have to unpack. But there's a handful of concepts to understand on how it helps. The nice thing is it helps in a lot of different ways. So, and part of it has to deal with the type of laser you're dealing with. So the wavelengths are important. How much power the laser has is a significant factor, because that can change how your tissue reacts to the pain, like within minutes versus maybe a couple hours after the treatment or the next day. So if you think about, from the simplest of terms, you have inflammation after you hurt yourself. So say you hit your thumb with a hammer, it hurts right away, and then it's throbbing as it gets inflamed and it's red and ugly, and you're like, oh my gosh, what did I do? You know, basically, if you shined a laser, a high power laser on that thumb, there's ways that it can impact the nerves that are giving the message to your brain that your thumb's hurting. And so you can get relief in a matter of minutes. It's really pretty nice. It's similar as if you got a pain shot, basically, right? And that effect can last, 18 to 36 hours, depending on how much light you get and the laser that's, being shined on your thumb. But on the other side, there's other types of devices that are lower power and, maybe doesn't have the same punch as a class 4 laser, which is a laser that has over a half a watt of power. Like the platforms we have for light force range anywhere from 9 all the way up to 40 watts. So a lot of power in the laser world. But there are lasers that have very, very small amounts of power, less than half a watt. And those are designed to help with circulation and helping cells get through inflammation. So if you put a low power light on that sore thumb, you probably aren't going to notice any relief like within minutes. But you may notice in the next day or two that, hey, it's feeling better. It's less inflamed. It's less red. It's less irritable. And that's because it's helped with the circulation to the area, and it's helped with some of those, cells that were damaged by the hammer start to mend. So there's a place for low power lasers, which is generally helping with inflammation, increased circulation, especially in very superficial parts of your body. So things that are close to the skin, they work well. But when you have higher power and with depending on the wavelengths that are used, that's a big proponent. You can reach things that are deeper, easier. So if you're dealing with a problem with a muscle in your hip or your back, it's easier to treat those as the clinician when you have a higher power unit. It's not that you can't treat it with the lower power units. It's just a lot more challenging. It takes a lot longer. And again, you don't get that immediate quick change in pain, which is often a thing that patients and clinicians, for that matter, too, are trying to accomplish when people are in front of them. So I know it's kind of a roundabout way to answer it, but I just to summarize it, laser helps with inflammation and getting the tissue to move towards the healing process out of pain. And then there's ways with higher power that you can actually challenge pain very quickly, which can make you feel better right away. So just kind of a couple sides to it.
Okay, so we're going to go just a little bit deeper, and for those of you who don't have much of a biology background, we won't spend a lot of time on this next part, but I just want to drill down a little bit deeper about the mechanism of how exactly that is helping a tissue heal. So can you speak, so the information I've received when I purchased my laser was that it stimulates that cytochrome C molecule on the inner wall of the mitochondria. Is that, can you kind of talk about that and why that is significant?
Yes. So we really want to get geeky now. So
a little geeky for a little bit, because some of my listeners
right.
really want to know,
That's right.
the detail.
No problem. So yeah, you're absolutely right. There's a spot on the electron transport chain, which resides on the inner membrane of the mitochondria. And there's 5 ribosomes that hang out there. The 4th one is called cytochrome C oxidase. And there's several, what they call chromophores, that are light absorbing molecules that rest there. And there's actually some that reside in other places in the cell as well, but that's the one that's been looked at the most. And basically when light hits it, it stimulates it. And what happens when you injure a cell, so say you have something that's been, think of a muscle fiber that you've strained, you pulled your hamstring. Now you have cells that have been damaged, the cell membranes have been damaged, and they're trying to heal. So part of that thing is they're going to release these chemicals into the intercellular space that tells the body, hey, I'm hurt here, I need help. So the white blood cells come, the macrophages come to chew up the bad debris. You start getting increased inflammation to get more circulation. It's all part of our natural process. Well, part of what's happening while that goes on is the cells that are injured, their metabolism gets retarded. So they slow down, and it's just a protective thing. They're trying not to die. So as they're hanging out kind of in second gear, they're not producing as much energy, not as much ATP, and that has an impact on a lot of different cellular functions, on the cell's ability to replicate, because the ATP is needed in the nucleus to help make more cells. And but that's not where the cell is worried right now. It's in a sort of a fight or flight. I'm trying not to die. So it's just kind of conserve its resources. So what happens is they've seen is that on that cytochrome C oxidase, that fourth ribosome in the electron transport chain, nitric oxide starts to bind to that spot, and it slows down its ability to pump out hydrogen ions outside to come back in to create more ATP. So when you hit that specific spot in the mitochondria with the laser and the light, it's reacts to various waveforms or wavelengths, some better than others. And when that happens, that nitric oxide gets released, and then all of a sudden you can start to create more ATP. So it allows the cell to start doing what they call oxidative phosphorylation, or creation of energy with oxygen, which is much more efficient than the anaerobic pathway, which is glycolysis. So all of a sudden the cell is happy because it starts getting all this energy to help itself. And on the backside of it too, it's also changing the number of molecules that are floating around that are telling the system, I got a problem. So there's a whole host of these little intermediaries that impact your cascade of inflammation. And it starts to basically pull the plug on them, saying, hey, I'm good. I don't need the inflammatory cascade anymore because I'm not going to die. I'm going to heal, and we can move on to the next cell, right? And so what happens is the flag that's waving for the body to bring on more inflammation, it starts to be brought down by these cells that aren't dying. So it's helpful in the inflammatory phase from that standpoint. But then on the tissue healing phase, you can just imagine very simply, if say you pulled that hamstring and you injured, let's say 1,000 cells when you did it. If this laser applied, in a short order after you've done this injury, helps maybe half of those not die, as opposed to say you had a bad strain and you didn't manage it well and you just kept running on it and pulling on it and what have you, and all 1,000 of those cells that were injured died, it would take longer for the body to repair the 1,000 versus the 500, right? So, because macrophages would have to do more work, they'd have to basically rebuild more with new collagen laying down and all that good stuff. So it's helping reduce the amount of reconstruction that needs to happen to an injured area, because you're saving more of the tissue, sparing it essentially from going into a bad place and maybe dying. So that's another secret on why the laser can help people bounce back or heal or get back to the playing field quicker, because it's helping reduce the amount of cell death that's taking place. The other side of it is that it's also, with all that nitric oxide that gets released, it's a powerful vasodilator, which brings blood to the area and helps healing. So oxygen is a really important thing when you're trying to get the system to improve. And that ability to do that helps the actual tissue that is being created to create the scar. Because when you have a torn hamstring, it basically has to fill in, right? And when that's getting filled in with the new, they call sarcomeres, or the sort of the brick and mortar of your muscle, what they've shown is that the laser helps that form better. It's a stronger scar, it's healthier, it's more aligned. And it's just because there's more nutrients and blood flow and oxygen around it, better fibroblastic, better collagen laying down. All those things are going to make the tissue healthier. And what they've seen is that there's a less likely chance that down the road you're going to re-tear the hamstring, because the actual the fix that's taken place by your body, it's healthier and better. So if you pull a hamstring, I'm just using that as one example, and you could talk about a lot of different tissues. It's a really good idea to get some laser on it, because you'll find that it'll bounce back a lot quicker.
Okay, so we're you've been talking about muscles so far. Does it work for all types of tissue, nerve, bone, ligament, and so forth?
Yeah, so it really comes down to like mitochondrial density in tissues. So when you start thinking about bone, ligaments, tendons, nerves, they vary significantly on how many mitochondria or even cells they have that can be impacted. So if you think about a tendon, for example, about 30% of the tendon material is cellular. The rest of it is just water and extracellular matrix and things like that. So there's not mitochondria in that stuff that can be impacted. However, the cells that are present, it can have a significant impact on its signaling to create more inflammation. Because what happens when you injure a tendon, you get a lot of fluid that influxes into that tendon to try to stabilize it because you've torn some of the connective tissue, and the body goes, "Oh boy, I got to fix this." And so it increases the water into that tendon, which increases the turgor and helps give it some stability. But the trade-off is it hurts and it's swollen and it doesn't feel real great. So the laser, when you're applying it, because it's going to help those cells that have been damaged to bounce back quicker and impact that cascade, you can see that swelling and pain in tendons will change faster than if you don't do it. So like we were part of a study where they looked at tennis elbow patients, people that had epicondylitis, and they treated it with the laser, and they showed that they got out of pain a lot faster. They were able to get functional quicker, and they had lasting relief. So when they looked at them a year later versus the people that just did exercises without the laser, they showed that the function and the pain of the people that got the laser was much better because the tissue would heal better. And obviously at a year out, all the inflammation was gone or what have you, but it helped the whole process, all along. So when you're looking at it, if you really want to get complicated, I mean, if you have tissue that's like a nerve has a lot of mitochondria in it, lots of mitochondrial density. That amount of light you need to impact that is less because it's like a sponge. There's more receptors there to grab the light versus the tendon example we gave where there's only a few. So they've found with dosing, when you put the right amount of light into the tissue, you need a lot more into the tissues that have less mitochondrial density. So bone or tendons, they need a lot more to respond. And then the other variable is the depth of the tissue. So getting light down through the layers of tissue is very challenging. So the deeper the thing you're trying to reach, the more light you generally need on the surface to get there. So if you were trying to treat a bone like a shin splint that was very close to the surface, that dosing would be very different than if you were trying to influence, say, a thigh bone, that was, underneath a lot of muscle and you're trying to reach it. You might even have trouble even getting there. So the more superficial the thing you're trying to shine light on, the easier it is for the laser to help.
So what about the discs in the vertebrae? What's the mitochondrial density of that type of tissue?
Pretty low. I'm not sure exactly what the cellular makeup is, but if you think about just the anatomy of your spine, those discs sit in the front of the vertebral body area, and it's obviously there's a lot of stuff that surrounds them. So getting light there is not very probable. I mean, even getting light to the nerve roots that are exposed a little bit more on the back of the spine is possible, but even that's a really challenging thing to try to do with light therapy. What they have done in animal studies and what they're looking at now is, basically the closer you can get the light to the source of the problem, the better. So for some of these studies they've looked at for pain and how laser can improve things, they've taken cannulas and stuck them into the back, which is like a big hollow needle. And then they stick a fiber optic, which has the laser light on the end of it. And then they shine it right close to the nerve that's of the problem or the joint of the spine there so that it's getting through the several centimeters of tissue down to the problem. And then they've shown it works really well. They've done the same thing in the brain where they've taken a cannula and ran it up the blood vessels in your neck to get up to the base of your brain and then shine light in there. And all of a sudden it can have an impact on different deep brain function. Whereas they've done other studies to look at like depression and things like that are more cortical that happen on the superficial part of your brain. And they can shine a light through your forehead or through your nose area to get to some of those things and impact that just because it's much more superficial, it's closer to the skull. So really pretty fascinating stuff, but like delivery is always one of the big question marks you're asking yourself when you're trying to help something. Like I get asked a lot, hey, can your lasers help like a pelvic floor problem? Well, the pelvic floor is, very deep into the pelvis and what have you. And so they do have devices that have insertables, that can bring light very close to those muscles and it works well. But to try to go from the skin, outside to try to reach that tissue, it's almost impossible just because there's too much depth to that tissue. So I guess the take home for patients listening to this is like, if somebody says they can treat something that is, 6, 7, 8 centimeters deep in your body, like, your bowel, for example, or something like that. Oh, it can help with irritable bowel. I see that all the time. It's just probably not likely, just due to the fact of how deep that is, and then all the stuff that's in the way, as far as connective tissue and fat and all those things. From a light standpoint, it's just very hard to get photons to go through all that. So be weary if somebody's telling you that they can help something super deep. The best lasers for musculoskeletal problems can get 4 to 5 centimeters of penetration on a good day with the right wavelengths and the right applicator and the right power, all the different things being right. That's probably going to be, on the long end of getting light to something. So beyond that, it's almost physically impossible to do it.
Interesting. So I wanted to go back to your explanation of how the tissue is healing. So roughly, I think I read somewhere that it ramps up ATP production by 3,000 or 4,000%. Is that off the mark, or what's the actual ATP increase production percent-wise? Do you know?
I've not seen a study that shows the exact number, and I think it would depend on the tissue you were trying to excite, and I think it would depend on the state of that tissue. If it's in an acute injury or a chronic problem, all those things would probably impact it. That'd be a challenging study to do. The ones that I've seen that kind of look at the question is like, you put tissue in a petri dish and then you shine light of a specific wavelength and power density on it and a specific dose, and then they see how that tissue responds, and it starts to give you a feel for how responsive it is. So like for nerves, for example, like a neurite, a cell, they'll shine the light on it and then they'll see how much does it grow. So you can measure that, say, oh, it grew 2 millimeters versus the one that I didn't shine the light on and it didn't grow any millimeters, or, a half a millimeter, so that this was, 4 times better than this. They kind of can go at it that way. And they've done a lot of that work in vitro on a handful of different tissues to see what's optimal. So what happens is people start going down that road because it's a very natural question. They go, oh, well, in the petri dish, these wavelengths are the best. And that's a true statement. But when you're treating in the body, where you have to get through skin and melanin and things like that, there's a whole bunch of trade-offs that you have to sort of consider in order to get the light down to where you need it. So just be wary for those amateur scientists out there. If you start looking at some of those studies and it's a in vitro in a petri dish type study, just realize when you're treating in vivo or in the body, when you're going, especially from the surface, there's a lot of other factors that need to be figured out to get an effective treatment, because it's not as simple as what you see on the lab bench with the petri dish.
Yeah, it never is.
Right. Unfortunately.
Can you speak a little bit, Mark, about the difference between a continuous wave and a pulsed wave in terms of, let's say, that hamstring strain that you were talking about? What's the difference in the effectiveness?
Sure. So when you're dealing with, well, there's a couple ways to come at this. So from the most basic standpoint, pulsing was created with lasers to help control heat for the most part. So if any of you have ever been lucky enough to go get a skin dysfunction, some sort of skin tag or a lesion on your skin lasered off, you've noticed that it's not the most comfortable thing, and then you feel a lot of heat. And those lasers, they pulse very quickly. And the reason they do it is so that it doesn't get too hot, so that you can tolerate it and not burn the skin. So whether you're using a laser like that for hair removal or for a varicose vein problem, or say you were doing a tattoo removal, these are all very specified lasers. They have to pulse in order for you to tolerate it. If they didn't pulse because of the high power density of those devices, they'd burn your skin and you wouldn't be very happy. So there's a place for it in the therapeutic laser world, but the intensity, the power density of the therapy lasers is much lower than like those guys I was just talking about for hair removal and vein treatments and things of that nature. So that being understood, when you're trying to put light into tissue, you have to figure out a dose. It's no different than if you were taking an aspirin as a baby aspirin as a 300-pound person, it probably isn't going to do much as if you took 3 aspirin, because now that dose is probably more appropriate for the size of that person. Well, with laser, it's the same deal. Like when you have a certain amount of tissue, you need to put enough photons in it to impact enough cells to make a change. And if you fall short of that, which is the most common problem with treating, is they tend to underdose things. They don't get enough stimulus to all the cells involved. The result is there's no big deal. There's no change. So the reason I bring that up is that when you're talking about dosing, it's joules, which is the product of power, which is watts or milliwatts, times time in seconds. So it's a joules equals watts times time. If you have less power, basically, so say your light source is blinking, which is what pulsing is. It's basically on and off, on and off. You're basically cutting down the amount of on time of the light. So it just means that when you start pulsing something, there's a thing called a duty cycle, which is in a given second, how much time is the laser on and how much is it off. So for light force lasers, the duty cycle is constant once you start pulsing it at 50%. So from a math standpoint, if you had set up a dose with it being on the whole time, constant wave, and say that took 2 minutes to do it, if now you started blinking the light for 50% on, 50% off, you're going to have to double the time to get the same amount of energy into the tissue. So clinically, the penalty you pay when you start pulsing light is that you're essentially increasing the amount of time you need to get the same amount of energy into the tissue. So that's the penalty you pay. The reason you might do it, though, is if, say, you were treating over something like hairline or a tattoo, something that gets hot very easy, you might be pulsing like that just to help control heat, to keep that more comfortable. Our devices that we sell, there's a lot of technology that's been put in to help you not have to pulse it and still keep it comfortable. But that's an option you have. The last little piece of the pulsing story when you start looking into the laser world is that there's a phenomenon called super pulsing, which is when you have a very, very small amount of time, like nanoseconds worth of time, and then they put out a very high, what they call a peak power. But because it's only on for a little blink of time, imagine like a radar gun that shoots out a beam and then bounces off and comes back, and you can figure out how fast a car is going. That's essentially the same type of laser technology that super pulsing uses. It's very small amount of time. So what that ends up being is that if you just glance at that and says, oh, it's a 25-watt super pulse laser, you would think, oh, it's a 25-watt laser. But in reality, when you look at the overall power it's putting out, the average power distribution, it's like tiny. It's very, very small. So that's a problem when you're talking about dosing, because you need to get, this much energy into the tissue to make something happen. And if you're just pinging away in these small little blips, it would take a long, long time to treat a big area with that. So sort of a long, drawn-out answer, but the short of it is, pulsing helps control heat. Pulsing in the therapy laser world, if you have the right setup and the right wavelengths and the right applicators, you generally don't have to use it. But if you do, you need to understand the penalties you're going to pay as far as your dosing equation so that you still can get good outcomes with your patients. And unfortunately, most people don't. They just go, oh, I'm going to pulse it because I don't want heat. They don't realize what that's doing to the overall energy they're applying. And then all of a sudden they're scratching their head why people aren't getting better. So
got it. Okay, thank you for that. I get a lot of questions about, hey, is this the same as cold laser or is this a red laser? And I don't know the definitions of those. So what's my laser?
Yeah, so yours is technically not a cold laser. That's a jargony term, but it's one that picked up a lot of traction over the years. They hear cold laser, it has a certain like safe feel to it, like, oh, that's cool. But what it really is talking about is in the FDA in the United States, there's different classes of lasers. So like the laser that you have at the checkout stand when you run your groceries over it, that's like a class 1 device or maybe even a class 2, but it's a very low, it's basically built on risk. And in laser world, it's generally risk to your eye. So that's like a very safe, like your laser pointer, you know, you could run it across your eye. It's not going to make you blind or anything, but we wouldn't recommend just sticking it there and leaving it there for minutes. You know, you could cause a problem with your retina if you did that. And then the risk to the eye and goes up as the classes go up. So in class 3B to be specific, that's where you have this shelf of what is a half a watt of power. And basically when you're below that, at a half a watt or below, you can put the applicator on your skin and leave it there statically, and it doesn't feel hot. So that's where the term cold laser came from, because you basically are putting it there for 30 seconds, 60 seconds, depending on the dose you're trying to create, and then you move it to the next spot and you leave it there. The fallacy is, though, is you can still burn somebody. I mean, I actually sat at a lecture once at a conference, and the gentleman was talking about this cold laser type device he was using in the clinic, and he was saying, yeah, he's like, you know, every now and then you'll get these scabs on patients after you treat them. He's like, it's no big deal, they go away. But you know, it helps them feel better and they're fine. And I'm like, yeah, you're burning your patients with how you're using that thing. He didn't even like put the pieces together. He was also showing videos of treating people around their eyes, which is a big no-no. So I was just I was in the back, sort of my mouth open, like, holy cow.
Wow.
But anyway, that when you get above the class 3B level to class 4, and that's sort of an all-encompassing, there's no class 5, it's just class 4. That's your surgical lasers, that's your higher power therapeutic lasers, that's industrial lasers that are cutting steel. They all pretty much fit into that class 4. Those generally create enough warmth on the skin that you have to move the applicator to keep it from getting too hot. So when it's done right, like with our devices, the light force lasers, and you're moving it up and down somebody's forearm or somebody's leg, it just feels like a nice warm sensation. It's like, oh, it feels good. So you're not burning anybody, you're not causing any problems. It just feels, you can feel it though, as opposed to the cold laser, you don't feel anything, you know? So that's where that term came from. But like as a family, if you want to talk about how to appropriately talk about laser as a whole class, whether it's the low power ones or the high power ones, they all fit underneath this term that they came up with in 2016 called photobiomodulation. So it's a bit of a tongue twister, but that term, if you're trying to look for a paper on what laser can do for your back or your neck, put that term in, photobiomodulation and low back pain and neck pain. And then what you'll find is you'll get all the studies that have been done within the last 5 years on laser. They'll be more current. The other mesh header that you might look at is LLLT, which is low level laser therapy. And that's another term that gets, you know, used very loosely, but essentially all therapeutic lasers are LLLT lasers. In some of the papers, they'll refer to the low power ones as LLT, and then they'll talk about the class 4 ones as HILT, high intensity laser therapy, but that's really not completely accurate. But we could talk for another 5 or 10 minutes on that. It's kind of a boring topic, but I mean, basically photobiomodulation is your term that really helps classify what laser is, but you will see that term cold laser a ton, and that hopefully will help you understand where it's coming from.
Yeah, thanks for clearing that up for me. Yeah, and I have seen HLT and LLT refer to the therapeutic laser. I'm just like, wait a second.
Right.
What is this?
Yeah, and the real term for that HILT, if you really get specific, it's over half a watt of power, and it also incorporates superpulsing as well. So it's a higher power with superpulsing. That's technically how they define that HILT. But
got it.
You'll see it used loosely in papers.
All right. So, you know, while you have people searching for photobiomodulation in their body part, we should probably talk a little bit about some contraindications for laser, things that you shouldn't laser, like eyeballs.
Yeah, eyeballs are up there. There are lasers that can help your eyeballs, but they're at very, very special wavelengths. So the ones that are in therapy lasers, you generally should have cool looking green glasses on to help protect your eyes. So you wouldn't want, that's the number one safety risk when you're dealing with therapeutic lasers, is risk to your eyes. So you should always have those protective glasses on as the treater. So anybody's in the room should have those. Basically, once you get outside of certain distances, depending on the power of the laser and the applicator that you're using, there are radiuses where if you're outside of that, you'd be fine. If somebody was treating somebody with a laser 40 feet away from you, and they happen to shine the light over you and you didn't have those glasses on, you're going to be okay. You know? But if you were 3 feet away from them and they turned around and splashed at you, that would be a different story. So
the danger is with the laser pointing directly at the eye, but
yes.
It's not like bouncing off skin and then going into the eye and damaging the eye like that. Is that?
So if it bounced off something really shiny, like a mirror,
Mhm.
or something like a piece of stainless steel or a diamond ring, something that really could bounce the light and have it not disperse, that could be a problem.
Right.
But like, for example, like on our lasers, for safety reasons, they're dispersive beams. So they're getting broader as they go out, and that's done for safety reasons. Because if you have like a laser that's used for like communications where they're shining lasers up to satellites, they have no dispersion, right? The laser stays at the exact same angle, shoots straight ahead. A laser pointer on your rifle, that would be the same thing. It would be counterproductive if it was dispersive because it wouldn't do its job. But that's the reason that laser is so cool. It's one wavelength and it can be basically honed in to be that linear, right? So you can point your laser pointer at somebody or at the back of the room that's hundreds of feet away, and it'll still be that little teeny dot. That's sort of the why. But bottom line is that when certain wavelengths in the near infrared range that therapeutic lasers use, it goes right through your eyeball basically, and it gets intensified on the retina. So basically, it can burn your retina very quickly, which is why you have to wear the glasses. So the good news is that's your biggest risk. So as long as you got on your protective glasses that come with the laser, you can't just wear your favorite pair of sunglasses. That doesn't work. It has to be specific to the wavelengths of the device. Your risk now of injury goes to next to zero. With the class 4 lasers, you're going to feel some warmth on your skin. So, but if it gets too hot, if you have normal sensation, you'll usually be able to say, hey, that's getting too hot, and then they can adjust. So that's people will like to tell the story of, oh, be careful, it's going to burn you or it's going to cut your leg off. It's not really the case. If you have impaired sensation, then you have to take some different precautions to make sure it doesn't get too warm. But those are the 2 big risks. So then you have medicines that you might take. So they have photosensitive medicines. So for kids that have acne, they might take Accutane. That's a classic one you have to be careful for because that can increase your chance of getting like a sunburn reaction, a burn from the laser. For adults, cold and flu season's coming, so antibiotics is another biggie that tends to make people photosensitive. But I get people ask me all the time, well, is this medicine safe? Is this medicine safe? You can do a very quick Google search, which is what I do when I get the phone call. I put the medicine in and then I put, is it photosensitive or photosensitivity for, put in the medicine and it'll tell you. But generally, if you've been taking an antibiotic and you've been out in the sun and you didn't get a sunburn, didn't have a bad reaction, or if you were out for a few hours, then you're probably pretty safe. I mean, I think the people that are probably the most at risk for that are people that are very fair complected. But you still want to be aware of this. So that's more of a precaution. Pregnant women, you wouldn't want to treat over the abdomen, low back or pelvic area, SI area. That's a no-no. Not that there's been any study that said, oh, if you shine this on a fetus, it's going to cause a problem. It's just that nobody's going to sign up for that study. So it's just a general precaution for almost everything. If you have a pacemaker or a pain pump that's installed, we generally advise to stay away from those devices and the lead wires, just in the very remote chance that they would create some warmth there. It's more of, if anything, God forbid, were to happen to your pump, the person applying the laser doesn't want to be part of that story as to what might have caused it. So in general, if light were to hit something shiny, like a stainless steel pump, it's going to just shine off of it in the body. But nonetheless, we advise people to stay away from that. And then for kids with growth plates, again, it's one of those things that's never really been proven in a study, but they advise to stay away from treating right over the ends of long bones where growth plates reside, to minimize any chance for some, limb length problem. But those are the biggies. And the last one would be an active cancer site. So if you had a melanoma on your arm, you would not want to treat directly over that. But if you're recovering from cancer, say you've had lymphedema because you had a breast removed and you have swelling problems or you have pain in the area, once you get the okay from the oncologist, and it could be as aggressive as, hey, I'm under chemotherapy now to address this, and we're using this to address pain and inflammation from the radiation. There's been studies that have shown it helps for that. There's like mouth cancers where people get these real red oral mucositis is what it's called. It's a really terrible problem that people get when they've had radiation treatments for mouth and throat cancers, and they can't swallow and eat. It can sometimes cause people to basically be fatal because they can't get enough nutrition in their system. But the laser's been shown to do a really nice job at helping those tissues in the mouth heal faster. So if you've had cancer, it's a question for the oncologist and your therapy team to say, hey, would laser be okay for me to try now? It's usually a case-by-case discussion, but it's usually they've done studies to look at putting light on different metastatic cells, and there's been some that have shown it did, but the vast majority, the last 2 review papers I've seen on it said it's very safe and not causing increased metastatic activity on a variety of different types of cells. So it's a tool that is used for lymphedema for that reason, because it can help out a lot of things. But that's a little bit of a gray, complicated one. You definitely want to follow up with your doctor. But those are the biggies.
And then genitals, I think, also, right?
Yeah, organs is another one. As they try to stay away from the thyroid, is probably the biggest one, because if you increase the metabolism of that, it can have an impact on a lot of different metabolic functions in your body. Mm-hmm. So they generally, if you were hypothyroid or hyperthyroid, you're taking medicines for that. If you stimulated the thyroid, it could cause a change in how your body chemistry is. So we stay away from that in the anterior neck, generally at the risk of causing some sort of problem with the sperm. Stay away from the testes. And in the case of the ovaries, they're so deep that it's really not a big concern, because getting light to that's hard. But yeah, generally we say stay away from organs for that reason. Right. But that being said, I mean, there's studies being done right now that are looking at treating brain tissue, our biggest organ in our brain, and it works really well for a variety of different things. So as a manufacturer, speaking on that behalf, we'd be very conservative with our recommendations and what we state as far as the device goes. But if you're interested in something that's a little off the beaten track, just look at the papers and research and see if it's something that's being looked at, and it's a conversation you could have with your person who has the device and see if they think it's appropriate for you. But
yeah, one of my patients asked about, and I think the answer is it probably can't get that deep. She asked about IBS or Crohn's or, things like that. So I'm going to guess it can't penetrate deeply enough to affect that.
Yeah, that would be really challenging to address. But like if you had some sort of cannula, again, that you could insert rectally and go into the intestine and shine light inside the intestine, it probably could have an impact. I haven't seen any study that's looked at something like that, but I wouldn't be surprised because it's a total inflammatory problem,
right?
For the most part. I could see how there could be something that could be benefited from that. But yeah, doing it from the outside of your body cavity that way, probably not.
Yeah. Okay. All right. So, it sounds like laser is good for, just about everything. What are the types of things that laser doesn't seem to help with?
Yeah, it's a good question. Now that we're, 30, 40 minutes into this chat, it starts to sound like, and you can start to get a sense, if a cell has a mitochondria, it has the ability to help it. So the range of things that light can help is very broad. But if usually you start a discussion talking about all the different things that can help, people are like, oh, come on, it's like, sounds too good to be true. So I would say the things that it doesn't do well with, it really comes down to depth, and can the light reach it? So most of the problems that you see in the literature are with conditions that are several centimeters deep in the body, because it's hard to get enough light there. So I would say as a class, if you're dealing with tissues that are more superficial, like in the extremities, elbows and wrists and hands and feet and knees, those are the things that in the face, things of that are very superficial. A lot of different laser products work well to get those things better. But when you start talking about the spine, the hip, things that are very deep in nature, it gets a lot more challenging. So to take it sort of to a second level is like, if you think about low back pain, okay? For those of you that might be listening to this that are clinicians, there's usually primary drivers and secondary drivers to somebody not feeling real well, right? So say you've hurt your back, and maybe you asked earlier about discs. So you have a disc that's bulged and it's irritated a nerve, and now you have muscles that are innervated by those nerves that are now guarding, because the body's just told it, hey, I hurt myself, I don't know what I did, but let's hold everything real still here and put these muscles in spasm. And that's usually when you can't get out of bed the next day and you feel like, oh my gosh, I'm going to die. I can't even roll over. So that's not fun at all, right? Well, that nerve root, if you're a man, it's about 4 centimeters deep, 4.5 centimeters deep into the body. So very, very challenging to get light down to that nerve root. It can be done, but it's challenging. But the muscles that run up and down your back that are on the top of your spine, that are just under the surface of the skin, that are often really big players in spasming and holding you still, those can be impacted quite easily with a higher power laser. And what you might notice is that you get a treatment and you get done and go, holy cow, I feel a lot better. The question is, did the nerve root get better that was inflamed and irritated? Or did you impact the secondary muscles that were helping protect and guard the situation? And it's probably most of the latter. But you as the patient don't really care. All you know is that now you can reach down and put on your shorts, or you can get in the car without crying, and you're moving forward in the right direction. So what I would just caution people on is don't get necessarily overly absorbed with, oh, my problem is this deep, so therefore the laser is not going to be able to help me at all because they can't reach there. I heard that guy on the podcast one day. Well, there's some truth to that, but there might be other things that are part of the equation that the laser will be able to help and get you moving better. And when you do that, all of a sudden you start now changing a lot of things that are coming from the messaging side in your brain on how you're moving and the pain and all those good things that can really help you move forward quickly. So that's something to definitely talk about with your healthcare professional if you're thinking about introducing the laser. Is, how will it impact my problem? And hopefully, if they can't explain it in terms of here's how I think it's going to help your specific thing because of X, Y, and Z, then yeah, you might hit the pause button. But if they can sort of lay out that story for you, it's probably worth a few sessions to see if it helps you feel better.
Yeah. So, you've mentioned the depth of that the light can go a few times as a pretty major factor for the efficacy of the laser. What about adipose tissue? What about fat? A lot of people are heavy, and so they have, it's further to get to that muscle tissue than others. So does the laser travel through the adipose tissue differently than maybe muscle tissue? How does that all come into the equation?
Yeah, so for any of you that have had the joy of being in an anatomy lab and gotten to see some of that fat tissue, it looks very different than muscle. It's yellow, it's shiny, it's very different than a striated red muscle belly, right? So those tissues, those fatty tissues, they reflect light a lot differently and cause scattering more so than a dense red muscle would, right? Or even a white tendon would, right? So when they look at how light goes through tissue in the body, because you have all these different substances that it's going through skin, hair, water, blood, has hemoglobin, deoxyhemoglobin, lots of different factors, fat, muscle that it has to go through. They come up with these special equations that very smart guys, a lot smarter than me, have figured out to figure out penetration as an average going through tissue. So it'll say, oh, okay, well, based on the average of people having this much blood and this much fat and this much muscle, blah, 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 we know that this given wavelength can go this far through it. So yes, the type of tissue that you're going through has a significant impact on how far light can go. And that's where it gets really challenging when somebody says, well, how deep does your laser go? Well, what's the pigment of your skin? Because the darker the pigment of the skin, the more light that's absorbed right on the surface. That impacts how much light can get at depth. How heavy is the person? Is it muscle? Is it fat? Is it somebody who is 6'5" or is it somebody who's 5'4"? All those things are going to impact how big that person is or how wide that person is. And all those things will impact, can I reach this person's back or can I not reach it? So it's a bit of a case by case on that question. But specifically to the can it impact fat, there's been companies that have really wanted to try to sell lasers to get people skinny. And so they've looked at, hey, are there special wavelengths that can cause fat cells to get stimulated and burn off faster? And there's been some very soft science on that idea. And it's in those papers where they look at multiple things. Hey, if we freeze cells, the fat cells, and then they basically die off and you lose, fat. There's ones that they're looking at putting real high intense heat, like hot needles into fat tissues, causing, thermal effects. Shock proteins get stimulated and can cause some reduces the circumference. But I think most of these studies, I mean, I think out of all the ones that I've looked at and read about, I mean, the cryotherapy is the ones that basically freeze the fat cells, and then basically the membranes die, they crack and die, and then the fat cells get absorbed, are the ones that I think have the best ability to make a change there. But that's not without its side effects. I mean, it's not a comfortable process from what I understand. You know, they really have to pinch on those love handles or the belly, wherever they're doing it. Then you get some significant bruising that takes place after it. So it's not just a simple, oh, I'll chill up my beer gut and I'll wake up and everything's gonna be great.
Yeah, my question was more of how does that impact the depth penetration of the laser?
Yeah.
So does the laser travel through fat easily and it doesn't affect it that much, or does it, does it diffuse the laser and, is it less, just like any other tissue? If you've got 4 or 5 centimeters of fat, then it's only going to get down barely to muscle.
I would say fat is not a great substance to try to get light through. So
okay.
If you had to pick your ideal patient, it would be a fair complected, skinny person. That would be your best laser candidate.
Got it. Okay. All right. One of my patients was asking about trigger points. What's the take on lasers with trigger points?
So trigger points basically are little spots in your muscles that are guarding. They're like little mini spasms essentially. And so your nervous system has gone a little bit awry in these peripheral spots, and that needs to kind of get reset. So you have to kind of understand the neurophysiology of sort of pain spasms. So you get this little tweak that's holding on, and that is affecting these little stretch receptors that are in the area, and they're getting hyperactive, which is telling the muscle motor part to fire again. And so it's this positive loop that just goes and goes and goes, and that thing tends to get tighter and tighter and more painful as it gets ischemic. There's less blood flow because generally muscles have to do this to be happy. So where laser comes in is that with these higher power guys that we've been talking about today, is you can basically hit the nerves that are sending the message back to the spine that are part of that loop. You basically can block part of that loop. And when you do that, all of a sudden now a muscle can relax. There's other ways to do it too, but for laser, that's the one way it does it. The other is that at the spot, it's going to help create vasodilation, which is going to bring in more blood flow, more oxygen to help that ischemic area that's probably irritable and having some inflammatory things going on. It's going to help turn that around as well. So like there's studies that have looked at people in chronic pain and fibromyalgia, and they've shown, hey, we treat, multiple points with the laser, and those people will have reduced pain, better function, better outcome with that approach to that treatment. So when you have a lot of that stuff going on, any good healthcare professional is going to want to know why do you got all these trigger points, right? And that could be stress, it could be bad posture, it could be a job that you do, it could be over exerting at sport or work, whatever. It could be a lot of things. But once they kind of can peel the onion down and go, okay, we know what's causing it, we're going to try to address that behavior, better desk chair, better, workout regimen, what have you. But when it comes down to trying to turn those trigger points around, the laser definitely has a place to help do it.
Do you, one of the byproducts of laser stimulation is this nitric oxide that you've mentioned. Are you familiar with any fascial research regarding nitric oxide?
Specifically, there's like one that showed, hey, you get this much increase after it. I have not seen something that was looking at that specific answer, but it's a mechanism that's stated repeatedly in the literature as far as treating tissue, and they've shown in studies that look at different of basically biomarkers of what take place, that the concentrations locally of nitric oxide do bump up when they use the laser on it. So quantitatively, I'm not sure what the number is. Yeah. But yeah, it's a pretty common referred to mechanism
the reason I was curious about this is, I've got my laser, and I expect a 50 to 100% pain reduction and increase in range of motion just with the one treatment that I get with people. And I often get that. And to me, the explanation of the mitochondrial or the vasodilation doesn't seem to explain how someone with maybe shoulder surgery can suddenly lift their shoulder, And so I came across recently some, in fascia research, they're talking about the nitric oxide relaxes fascia. And so I believe that is another component of laser that is affecting these huge pain reduction gains, and then also the range of motion gains too. So I was just kind of curious if you've run across any of that.
Yeah, so definitely nitric oxide plays a role in pain. I mean, when you have different concentrations, it impacts your little nociceptors in that area on how they behave. And I mean, it begs a very interesting question, and I would state the actual exact mechanisms on most things, when you're talking about a drug or you're talking about a device in our world that we live in, the exact mechanism of how they do their thing is usually not completely understood.
Yeah.
And laser, it fits into that description. They have a pretty good idea that there's some things that are taking place, and there's some definite things that they can point to that we see these phenomena happening. But to say that they have it ironed out to the level of we know exactly how laser impacts a nerve, a muscle, a tendon, a bone, from a mechanistic standpoint, the field's not there. It started in 1967, roughly. That's when it started. And the amount of research that's been taking place looks like a big hockey stick if you looked at the volume of information that's out there. But they're still trying to figure it out. And the point of where it is with getting the answer to how it works is now like figuring out what's the right wavelength, what's the right dose, what's the right way to get this to the place that we're trying to treat. Whereas 20 years ago, it was still sort of like, does it work? Is this something that can help this problem? And I think that the research has kind of crossed that little bubble. They're over that hill of like, does it work? Yeah, it works. I think they've seen it happen in enough different camps on different parts of the body, but now they're really trying to zero in on what's the best dose for it to work. And that's still ongoing right now.
Yeah. Well, it's been so in my clinic, we don't use gadgets. We don't use, ultrasound or e-stim or all the, whatever gadgets are out there that a lot of clinics do. But we do have a laser machine. And that, as my daughter said, the most technological thing in our clinic was that our tables move up and down. And then we walk in with this laser machine. It kind of blows that out of the water. It has really been a phenomenal addition to our how we help people at our clinic, and it just really expedites training, or I'm sorry, not training, but therapy. It's just an amazing tool. And you and I were talking earlier about, the therapist as the gatekeeper of allowing laser to happen or suggesting laser. One of the things that I've run into with my clinic is, some of my therapists are resistant to recommend their patients to laser, even though I've asked them to recommend their patients, all patients to laser regardless, because we just, we only know the effect that it's going to have once we try it truly. And so, we give a free laser session to everyone, usually, I hope, by their second or third visit. But there is this reluctance by the therapist to recommend it to their patients. And I think that's an interesting thing, I think, to think about, is the therapist as the gatekeeper to something that could actually help you. That maybe they're not familiar with it, maybe they're quasi familiar with it and don't believe in it or whatever. Do you have any thoughts on that, Mark?
Yeah, because that's a question I have to deal with different clinic owners on a weekly basis, when I'm talking to them about their staffs and what have you. And I think
so. I'm not the only one.
No, and it probably centers around a few things. I think there's probably a little bit of hubris, as far as like therapists don't want to be doing something that they can't confidently talk about, to their patient. And so generally therapists tend to be pretty conservative people, and they want to know how something works before they start trying to apply it to anything. They want to understand it. And for those of you that have been hanging in here for the duration of this talk today, you realize there's a lot of different aspects to this laser thing to figure it out. So it's not something that you can become really an expert on in a 5-minute read of a little pamphlet. So there has to be the desire to invest oneself into understanding and learning the technology and seeing how it will impact different conditions that you might be trying to treat. Once you've taken on the onus to learn this stuff a little bit, read a few papers, maybe read a chapter in a book, maybe listen to something like this, and you go, oh, okay, now I kind of see how this sort of works. And now I'm going to start looking into maybe a little bit more specificity to get into dosing or what have you, to get things that I'm treating most commonly better. Or maybe I want to try it on these 2 things and see how it behaves and do their own little study. That takes energy, and it takes effort and desire. And so if you get anybody who's even marginally lethargic, who goes, I don't really feel like doing it, then guess what? That's going to feed into the first part, which is I don't want to talk about something with my patients I'm not really comfortable with. And then all of a sudden the thing just falls down. So it has nothing to do with the fact the device can't do its job. It's just that the person applying it isn't skilled enough to explain it, talk about it, and educate the patient on here's how it's going to help you, and then know how to set the thing up to actually have it deliver. Once you get that little circle established, though, of, hey, I understand how this thing works, and I know generally how I should dose this for the type of problem you have, sir, in front of me. What you're doing is very common. People say, well, I don't want you to listen to me. I want you just to try this and you tell me if it helped. And so you do the treatment and then you go, how do you feel? And if it's somebody who's got like the back problem we were talking about earlier, and they come in stiff as a board, and now you've quieted down some of that spasm muscle guarding, and now they can bend and touch their knees and come back up, they're going to think it's some miracle, right? But it's basically you've just impacted their nervous system in a positive way to help them get better, which is awesome. And that's exactly what it's designed to do. And I mean, to the last point, it kind of ties into that earlier question, is just that even if you don't know exactly what it's doing, I mean, I have a pretty good idea what it's doing in a lot of ways, but I don't know exactly what it's doing in some cases. But I do know dosing and what generally will connect the dots and making something change clinically. And that's what you've seen every day when you're treating your patients. And at the end of the day, the patient then gets to make the decision, okay, well, Rick couldn't explain to me the 19 mechanisms on the inflammatory cascade that this thing is doing, but he did this treatment on me for 5 or 6 minutes and I felt 50% better after he was done. So I don't really care what the actual mechanism is. I just know that it helped me. And so as the consumer, I would not get caught up with all the minutia and the nuts and bolts of the science behind this thing, because there's a ton. I would just put your cap on from the most broadest perspective and go, okay, I'm going to give this a shot and I want to see if it makes me feel better. And that window probably, to be fair, should be about a 24-hour window, because you will see some change possibly right away, like Rick gets in his clinic. But you really might see the needle move 12 hours later. You might wake up and go, holy cow, this feels a lot better, because now the system's had a chance to get caught up and get moving forward. So if after 24 hours, you go, well, my pain feels exactly the same and I move the exact same way and I still can't sleep and I still can't do this, you still might benefit from it if you give it another trial or two, because some things that are really stirred up or really chronic need a handful of treatments to move the healing process along to a new spot. So I would still not throw it out of the boat right away. But if after usually 3 treatments, if you haven't noticed any change, then probably there's something amiss. And I would say in most cases, if you have the right equipment, like what Rick has, if you're not moving the needle with your average patient in 3 visits, then you should be talking to someone like me to go, let me hear about how you're dosing, how you're treating, what's the power settings, what are you doing? Because there's probably something that's not quite right.
Yeah. And the way I explain it is, in terms of mechanical hammers. So if you have 10 mechanical hammers working on your back that haven't been corrected, well, the laser can only help temporarily relieve that pain, and then your hammers will keep hammering. And that's why doing it in conjunction with the therapist who's removing those hammers from your back as you go, it's not a replacement for treatment. It's in conjunction with treatment. And so sometimes the response that you get from the laser, in my opinion, tells us a lot about how significant are the hammers that are still working on your body, right? A shorter response, well, you've got some still mechanical issues, major mechanical issues that are working on this. And the longer the response is, the closer you are to perfect, you know?
And I would say generally, I would completely agree with that analogy. However, I would say this, especially with chronic problems, sometimes the thing that's hanging on is the last little piece of an equation. And like the examples I've seen are, I've been at shows where I sit there with other people in different booths for multiple days, and you end up cross-pollinating and talking about different products. And, you know, they go, what's that thing do? What's the laser do? Oh, well, it helps us in this. And I had a kid once, he's a young guy, 20 something. He's like, hey, he's like, my elbow's been sore for 6 months. I've tried therapy. I've tried everything. It's still sore. It's like, I can still do my job, but it's just really annoying. You think that thing would help? I was like, maybe. Like, let's see. So I literally spent about a minute treating his elbow because it's a very small area. And we got done and he was like, wow, that feels better than it's felt in months. I was like, that's great. And I said, well, how long have you had the problem? He's like, 6 months. I said, well, let's treat it tomorrow when I see you in the morning. And I said, and then we'll treat you one more time Sunday before we all go home and pack it up. And so I treated him again the next day. And he was like, now the pain's gone after you just did that treatment. And he goes, this is unbelievable. And when I showed up on Sunday with him to do the third treatment, he's like, it's fine. He goes, it doesn't hurt anymore. You know, and he's like, I can't believe it. So sometimes there'll be this little nervous sort of connection that's creating this chronic pain loop that you can break. And you might do a treatment and magically it was like magic. Like, oh my gosh, now it's better, right? Which we're all searching for. So you're absolutely right in that if there's multiple things that are contributing to why something hurts, with bad posture, overweight, weak, you know, you name it, right, on a normal problem list, yes, you're probably going to have to clean those things up. But it's absolutely amazing when you're dealing with some of those chronic-y things. Sometimes a treatment or two, it's just like a magic wand, you know, and they're like, I don't know how it did it, but now it's gone, you know.
Yeah.
And for me, it's like, I don't really care what it did. It did
Yeah.
it. So that's
it's
great.
Pretty cool. I have to say, it's pretty cool and surprising, you know, so I'm loving it. Well, Mark, if someone's interested in looking into getting a laser, where should they go to find your lasers?
Yeah, so we are now part of the DJO Chattanooga family, Light Force Therapy. We joined that team about a year ago, and we're still in the process of trying to patch together one nice, harmonious website. But the place to get the best, easiest access to laser information, and if you wanted a demo or you wanted somebody to talk a little bit more about numbers and things of that nature, go to lightforcemedical.com. That website will have a ton of information. There's lots of videos. There's about 20 of these types of webinars that I've done on a variety of different topics. So if you're really curious about how it can help, if you really want to get into the nuts and bolts on pain, I did a full hour on how it impacts peripheral pain. So if you really want to go down that road, you could get that. How to dose backs, knees, sports condition, things like that. So it's all there. And then there's a whole bunch of abstracts and things we have on different studies that you can look at. But basically, if you click on the demo request, then someone will reach out to you and just say, hey, you know, where do you live and what can we do? What questions do you have? And if you want, one of our sales folks can come in and set up an appointment to come in and actually let you treat a few patients with it, and you can see what it does. That's usually the best way to get comfortable with how it can help your patients. Yeah.
And talk about pain, and maybe you'll get a new house or something.
There you go. That's right. But I would tell folks, you know, you brought up some great questions today, Rick. I mean, for the general therapist that bounces across this thing, be curious. That's what I would say. Just be curious. Look at this thing. My own history was, I was a manual guy too. I didn't use I used an occasional TENS unit and an ultrasound and a blue moon when I was treating people when I was in the trenches day in and day out. But I knew nothing about lasers. I didn't know what the heck they were. But flash forward 5 years after spending a long time looking at this stuff and the science behind it, it's a tool that if you're not using it with your folks, you're really missing probably the most powerful tool you can put in your belt to help people on a day-to-day basis. And the nice thing is it could be applied to just about any itis, OCS, pain type patient that you're dealing with, whether it's nerve, tendon, muscle, it's going to have a place most likely to help out. So at this point in my aging career, if I had to go back to treating patients every day and I did not have a laser to help people get better, I would really be frustrated because I would know how quickly I could be moving the needle with that tool. And without it, you're basically slowing down plans of care, by 20, 30%, if not more.
Yeah.
So
I'm saving up to get one for my home. So
perfect.
to help me get out of bed in the morning.
Well, the risk you might have if you have kids at home, like I do, I have 2 high school athletes. They seem to think that like muscle soreness and strain is something that goes away overnight because they're healthy and they're 14, 16-year-old. They come in and go, yeah, I heard something at practice today, is a little strain. You treat their thigh or you treat their hip, and then you see them at 7 o'clock the next morning and you go, how's it feel? They're like, it's fine. I'm like, that is so cool. And they're just like, whatever.
Yeah.
That's how it works. You just put that light on it and it's fine. So
exactly. Yeah.
they're going to be in for some harsh reality in a few years, but I guess we'll just sit back and laugh when it happens.
Yeah. Well, Mark, thank you so much for all your time and answering my questions. And, it's a really fascinating area of medicine and treatment. And you really, no pun intended, shed a lot of light on it. So
hey, there we go.
Very much.
Well, it's been fun. So I appreciate it. We'll do it again down the road.
Okay. I'll talk to you later. Thank you.
Thanks, Rick.